All right, everyone. Thank you so much for joining us. We are so glad to have you. My name is Jill Miranda, board member of Outcare Health. My pronouns are she, her, hers. Thank you for joining us for the Outtalk series, a webinar series devoted to discussing diversity and intersectionality within LGBTQ communities. We have many people across the world tuning in today. We want this to be a safe, welcoming space for everyone, so please feel comfortable asking any questions today. All Out Talks are recorded and can be watched on our website. Very excited for this one in particular. Inclusive Care at the Crossroads, the Power of DEI in Affirming Healthcare. Today we'll hear from inspiring people doing amazing work across the country. I'm very thankful for our moderator today and always. John, take it away.
Thanks, Jillian. Welcome aboard, everyone. My name is John Sobek. My pronouns are he, him, and I'm located here in Pasadena, California. And I really want to welcome all of you and our panelists to this really timely conversation about diversity, equity, inclusion, especially in its relationship to LGBTQIA plus care. So the first thing to start off is I want us to meet all of our panelists. I'm going to ask them to introduce themselves, tell a little bit who they are and what they do. And then they get a bonus question live. They're hearing this for the first time. And today's bonus question is, what was your favorite candy when you were a kid? So that's your bonus question. And Greg, I'm going to toss it to you to start us off today.
Thanks, John. Hi, everyone. My name is Greg Foshheim. I use he, him pronouns, and I am a partner at the law firm of McDermott, Will, and Emery in Chicago. McDermott is a global healthcare or a global law firm with practices across the industry, but we have a strong specialization in healthcare. And that's what made me choose McDermott. My practice really focuses on the delivery of care, particularly in the clinical laboratory and clinical research spaces. And I began my adult life as a clinical microbiologist at the Centers for Disease Control in Atlanta. But I pivoted out of that probably around the Affordable Care Act when I decided that there was an important role for people who spoke fluent healthcare. To join the legal industry. And so I advise a lot of clients on the delivery of care through clinical laboratories, on the importance of accurate regulation compliance. But in particular recent years, I've had a large focus on what's called Section 1557 of the Affordable Care Act, which is the non-discrimination provision of the Affordable Care Act. I've worked with Omar on several panels on 1557, and really since January, the 99% of my work has been interpreting the executive orders regarding gender-affirming care and counseling hospitals across the nation on how to comply, what to comply with, how to continue providing care despite the executive orders, how to thread the needle in states that may have restrictive care, or in how to comply both with state law that allows for gender affirming care despite the executive orders. So just a lot of very challenging conversations with hospitals and providers who are scared, just like many of you are. So really a pleasure to be here today. My favorite candy as a kid is the same candy that is my favorite today. And it's stale Peeps, the Peeps that have been on the shelf for about a year. I like them almost crunchy.
So you're heading into your season real soon here then.
Oh,
Okay.
yeah. My birthday was Sunday, and the amount of Peeps that I got for my birthday was kind of obnoxious, but that's my jam.
Thank you for sharing. Omar, why don't you step in next?
Sure. Thanks, John. Hi, everybody. Omar Gonzalez Pagan, him pronouns. I am counsel and healthcare strategist at Lambda Legal. Lambda Legal is the oldest and largest legal organization committed exclusively to the full recognition of the rights of LGBTQ people and people living with HIV. And in my role over the past decade plus, I have been primarily working in the sphere of ensuring proper application of the Section 57, the non-discrimination provision of the Affordable Care Act, litigating numerous cases across the country pertaining to access to gender affirming medical care, both from an insurance perspective as well as from a provider perspective. And most recently has been dedicated to battling a number of the executive orders by the Trump administration attacking federal funding for healthcare providers and access to gender affirming medical care for people under 19. And we have done that quite successfully so far. The executive order pertaining to the denial of care for people, transgender people under 19, is actually currently enjoined nationwide. And that will continue at least for the rest of the year while the case is moving forward. So um, our goal is to ensure equity within this realm, and we'll talk a little bit more about some of our clients and cases as we go for the night.
And
Oh,
Omar,
and
your
my favorite
candy.
candy. I actually was not a candy person as a kid, um, or even today. I would say a Hershey's Kisses, but I do have an affinity for candy corn,
Ah,
just to be
okay.
controversial.
You either like it or you don't. Thank you so much. And Tony.
Hi, I'm Tony Newman. I live in Los Angeles, but I'm the director of the Coalition for Justice and Equality Across Movements. I know, long name, at NMAC, the National Minority AIDS Council. And what we're doing at the coalition is bringing national groups such as Lambda Legal. We work with Jose Abrigo, HRC, the American Medical Association, the National Bar Association, to try to keep the Affordable Care Act, the Ryan White Act, and also trans care continued in America. We're just standing up for marginalized communities who need health care, and they need assistance with health care. They don't make enough money to provide their own health care. So that's what we're doing at NMAC. I am a Black trans woman of color. I run 3 organizations, the Black AIDS Institute, the Lyric Youth Foundation, and the St. James Infirmary Clinic. So I'm very ingrained in HIV and running organizations that really serve poor, marginalized communities, especially the trans community, the immigrant community. Those are passions of mine. The bottom line is we're all Americans, and we, regardless of race, sex, and gender, and we deserve health care and just equal rights, not asking for special privileges. I think sometimes the message that trans folks are asking for special privileges, I'm just asking for equal privileges, to be treated as every other American who pay taxes. For many, many years in America, we should get the same rights as white heterosexual males who are now running the country and trying to tell us that we don't exist. So we do exist. My tax dollars say I pay taxes every 2 weeks, and I deserve health care as well as every other trans American, regardless of where they come from, regardless of race, sex, and gender. We deserve health care. Peanut clusters are my favorite. I went to Wake Forest, and I used to chew those as a demon deacon at the basketball games and football games. They used to sell them at the concession stand. And I love those things. I pick them up at the airport all the time. I forget the name of the company that sells the peanut clusters. I just saw it at LAX when I arrived at SFO. I can't think of the name, but I bought a box and ate them. So I love peanut clusters.
I'm
And
surprised you saw him at LAX. Wow, that's cool. I
they
love
have a
it.
stand. I can't think of the name. On the way to LAX. What is it? What? SEES, seeds. My husband
There
said
you
it
go.
was
Ah, good old
seeds.
C's Candy, which
Yeah.
actually started here in Los Angeles.
Yeah,
Yeah.
he just finished the box. Yeah, I love those things.
Lovely.
There we
Well,
go.
once again, everyone, my name is John Sovek. My pronouns are he, him, and I'm a therapist in Pasadena, California, and I specialize in working with LGBTQIA plus adolescents and their families during the coming out process. I am also the author of Out, a parent's guide to supporting your LGBTQIA plus kid through coming out and beyond. And I'm always excited to be part of this work with Outcare Health. It's an amazing organization. And just looking in the comments, Dharma, my favorite candy as a kid was Three Musketeers. And as an adult, I cannot stand them. I don't know if they changed the recipe or I got adult taste, but I can't do them anymore. It's kind of sad or good, however you want to look at it. But kind of going from the, the kind of silly to the much more serious, and especially right now in our country, there's a really serious topic we're looking at, especially for healthcare providers really trying to provide access to care for our communities. I think the place to start at is really looking at, the inequities that do show up, that have in the past impacted the healthcare experiences of LGBTQIA plus and BIPOC people in just trying to access the most basic levels of care, like where we have come from. And I see both Tony and Greg, you got some nodding going on there. Maybe you'd like to start us off with this part of like just really looking at where we've come from with this.
I'll go first. Well, let's be honest, trans healthcare has never been at premium nature as far as getting healthcare. I mean, I paid for my transition myself when I transitioned from being an assistant dean and as an educator from a male to being a trans woman. So trans people have never had like the very best. I have great healthcare now because I have a great job, but 65% of trans Americans, especially people of color, are living in poverty. So they've never really got, I mean, if you look at some of the surveys, 49% say they were unhappy with their health care treatment before the executive orders came out in the very first place. I mean, a lot of them were not being spoken to in the manner that they wanted to be spoken to. So healthcare for trans Americans have never been for poor trans Americans. Let's say the ones on the border, the marginalized, they've never had good health care. And now that we're being labeled as not being existing in America, and a lot of the healthcare institutions, 29 in the country have now said they won't do gender affirming care. Some of your bigger FQHCs. We weren't getting good healthcare in the first place, and now you have 29 national FQHCs. So we went from a okie dokie, could get better type situation to now it's just not very good at all. And that is my concern here at the coalition. What are we going to do and where are we going to stand? Where are you going to stand when we ask, what did you do during these times of trans Americans being denied? What side are you on? And I'm hoping most of these callers on this can say, I stand with you and will help fight for you to get good health care, since over 62 to 63% are living in the poverty without the ACA, without Ryan White, without Medicaid, without Medi-Cal. They won't get any health care at all. They can't afford it. So what are we going to do about that? We need to continue to fight that trans Americans continue to get health care. And I'll pass it over to Greg.
Yeah, I agree with that, Tony. And my perspective is I have not lived through a trans experience, so I have the privilege of being a Midwestern white male of middle age privilege. Um, but it hasn't always been easy for me either as a gay man. I recall living in Atlanta in the 2000s, and I was relatively middle class. I was working at CDC at the time, and I was sitting on a grant review panel where we were funding HIV prevention in sub-Saharan Africa. And this was in the Bush administration, and we were not allowed to fund anything that had to do with the C's of the ABCs of HIV prevention at the time. And that was abstinence and being faithful and using condoms. Um, is if condoms were in the grant, we had to strike it. We had to give it a 0 score and move on. So this administration's playbook is old. It's stale. We've seen this before. We've seen censorship. We've seen erasure. We've seen hatred towards strategically marginalized communities. It's unfortunate that it is our Black trans brothers and sisters who are facing the major component, uh, but it's all of us. And so I really I say that not as a warning. I say it as solidarity. We all need to be in this together because we have seen this before, and we can come together and defeat, but it does require unity.
I just wanted to say one quick thing. If they take away my rights, young folk, they will take away yours. If they feel that they are successful at getting rid of the trans community, and I want to speak for not only Black, but Latin, Asian, all of my minority trans. If my rights are taken away, don't be naive that they won't come and take yours. So we need love and unity and collaboration in this movement, because if they take away my rights, they will come after yours if they feel successful enough to take mine. So we really need unity, what Greg is saying, collaboration. Whether you believe in what we've done to ourselves or not, as I tell my North Carolina people who think God has spoken and he never meant for me to have the transition. Okay, that's great. But if they take my rights away as a native North Carolinian, educated both undergrad and graduate in North Carolina, they will take away yours in the LGBTQIA plus. They're going to come after all of us. So if they take away one, they'll take away all.
And Omar, what might you add to this?
Yeah, I think I agree fully with what Tony and Greg have said. I would just add, our healthcare system has always been broken. And the systemic barriers that are faced by underserved populations, people of color, and sexual and gender minorities have exacerbated those healthcare disparities and access to healthcare. Couple them for folks who have that intersectionality of identities, and then that's multiplied, and it makes it even harder. And what we're seeing today, and what I hope we can talk a little bit more about, is how the attacks on efforts to ensure that we can combat those systemic barriers actually truly endanger the health and well-being of those who need our help the most, and those who we should be caring for the most. And so I think we were on a path of equity and inclusion in a very imperfect and broken system. And we are now in a place where we have to essentially hold the line to ensure that we don't go back to even worse times, where people are not just facing systemic barriers, but are also just being completely forgotten and their health needs are being completely ignored.
I agree with that, Omar, but I want to put just a quick little bead on the point that you made. We were on a path towards equity, but I think we were also on a path towards laziness. I think many healthcare providers and institutions used equity as a shortcut without continuing to remember that all people do require and deserve and merit care under Section 1557. There were a lot of interventions that were not marketed well towards making it clear that everyone is open to this. Such just generic things as sending HIV and STI prevention materials only in Spanish when everything else, when everyone, all other languages would also benefit from that. And those are some of the interventions that I don't want to be an apologist for this administration at all, but those are some of the things that I do think that we need to keep remembering, that equity that leads to exclusion is not equity. As we're raising the stakes for everyone, intersectionality still needs to be recalled. There are still poor white women who would benefit from maternal fetal care, and so I think that's one of the things that I'm counseling a lot of clients on as they're going through their DEI materials, is why are we in the crosshairs, and just kind of having some of those hard conversations of are you making sure that everyone who deserves this care, including trans individuals, can access the care that they are entitled to access.
Well, I think all of you are touching on something that I think is really important to bring into this conversation, is really with all the misinformation that has actually been out there for years and is just being exacerbated currently. What are the common misconceptions about diversity, equity, and inclusion in the healthcare system? What are some of those common misconceptions that are being put out into the world?
Well, I think we just need to start with from the premise of what this administration believes and then what the reality is. And there's a huge disconnect between those two. Um, First of all, having the values of diversity, equity, and inclusion to me is laudable, and it should be something that we should all be striving for. Somehow, apparently, it is a boogeyman word for this administration and its supporters. To them, efforts to reach underserved populations means that we're discriminating against privileged people who also need healthcare. Let's get real. And nothing could be further from the truth. I think the mentality of race blindness, the mentality of socioeconomic blindness, of sex blindness, or gender blindness, or sexual orientation blindness, all that leads to is us ignoring the health disparities that exist and us not being able to reach the people that we need to reach in order to ensure that everybody benefits from having a healthy population from a just a purely public health perspective. Just if you're somebody that has the privilege to not face systemic barriers in healthcare, you still benefit from ensuring that other people that don't have the outreach usually to and the access to that healthcare get it, because from a public health perspective, everybody being healthy is a good thing. um our current Secretary of Health and Human Services may not believe that. He also doesn't believe in vaccines, but that is the truth, right? And so ultimately, to me, the problem here right now is that they consider the values of diversity, equity, and inclusion to be discrimination when it is not. It is remedying discrimination. And the reality is that they're not even that effective at targeting the issues, really. They're just performative, but in such a way that is truly harmful. Just today, I've been prepping an exhibit for a filing tomorrow, where we represent FQACs that serve our population, including underserved populations like the LA LGBT Center, the San Francisco Community Health Center, who are some of our clients, including San Francisco AIDS Foundation, in this case, in California, challenging to the Trump administration's executive orders on gender and DEI. One of the exhibits is a news story that sets out the 197 terms that this administration and DOGE used to decide to eliminate research grants and federal funding to healthcare providers. And it's just literally terms like race, Native American, BIPOC, transgender. And literally, if those terms are included in any research grant or application, they're being terminated. And that is to the detriment not just of the populations that don't get access to this public health information, public health services and public health research, but also it is to the detriment of everybody. And I think that's what's being lost in this conversation. When you actually harm one sector of our society's healthcare, you're harming everybody's healthcare.
I just want to say trans Americans are just seeking health care. I think there's some type of myth. We only are 1.5 million in a country with over 300 million people. So why in the hell are you picking on us? I'm not sure. But I think there's been some, I fly all the time and I hear a Republican told me, trans people want special privileges. That is so far from the truth. I don't know one trans American looking for anything special, but only good health care to transition. And another myth is that 14-year-olds and 15-year-olds are having what we used to call sexual reassignment surgeries. Now it's called gender affirming surgery. These things are not happening in America. It's not happening. 14-year-olds are not getting female genitalia to male genitalia, blah, 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 blah. This is not happening. You have to be an adult. I don't know one 14-year-old who've had a surgery to do that. So these are just premises that they put out that young people are having surgeries and we're looking for special privileges. We just want good health care. And as Omar has said that, It was broken. I mean, we were in the process of training, trying to train doctors through the American Medical Association on how to treat a trans person during the Biden administration. And Trump is just, we can't even go to medical schools now. They are not open to us coming to say, how would you treat a trans man or a trans woman? Everybody's health care individually. Mine is not the same as Dr. Rachel Levine or Laverne Cox. My needs are different. Greg's needs are different than Omar. None of us have a same type need. We just want good health care. And I'm just saying, with only 1.5 million Americans being trans, I think we've taken this thing and blown it up to like we are a major population and we are such a small, we're less than 1% of the American population. In America, I mean, we would need to be at least 10 million to even get over 1%. And we're just not even there. My thing is, why are you picking on one because we are so poor? 65% of us live in poverty. And I think that's where it's wrong. And they're saying DEI. No one here is looking for anything extra that Greg or Omar or John is looking for. We all just want good health care and to live happily as American citizens. So I just want to put that out for the listeners that most trans Americans are good people just looking to live a happy life with a happy family, just like everybody else. No more, no less.
Greg?
I've stopped using the word DEI and diversity, equity, and inclusion in most of my conversations with healthcare providers. Instead, what I focus on is quality, access or accessibility, and empowerment. And reframing the conversation so that it's patient first. What does the patient benefit from this interaction, so that they are reminded kind of why they got into the delivery of healthcare at the beginning. As Tony said, every individual's healthcare needs are individual, and they should have the ability to have those conversations with their physician, with their nurse practitioner, with their care team that's intimate, that's honest, that's welcome, because there is nothing more intimidating to most people than being in that kind of sick role, to be not feeling well, to have that vulnerability. Um, we all should be having our annual physical. That's something that every person needs. We all should be having at a certain age annual prostate or annual breast examinations. That's something that every person needs. But if you don't feel like you are going to be affirmed for these routine services, um, that's when social determinants of health really start to pick up, and that's when inequities start to become chronic. And so it's far more than a gender diverse person unable to access gender affirming care. That's really just the tip of the iceberg if they can't also get routine preventative services.
And I want to take our conversation now and just turn it a little bit, understanding that we have people listening with us today and who are listening to the recording in the future who work in private practice, who work in clinics, who work in hospital settings, who are still getting their education. What are ways that organizations can actually still create more inclusive environments in this challenging time? How can they still understand these values are really, really important to the community and build within their systems access to this diversity, equity, and inclusion levels of care? How can organizations, individuals still try and move this forward under the pressure we're feeling right now?
So I'm going to come at this from a little bit of a perspective, and I think Greg can be the counterbalance on this for me. In some regard, I would push back even on the idea that we need to censor or change how we speak about these issues in response to this administration. I don't think we should. I don't think, particularly this administration, I don't think there's any hope that when you give in to the bully will just want more. And the reality is that these are values that are important, and the efforts that seek to meet these values are particularly important. And we shouldn't be giving up on that for the sake of compliance with, frankly, unlawful mandates. And so it is a hard proposition to hear, which is that, from my perspective, folks need to stiffen up their spines and fight back. And we represent a number of federal qualified health centers, community organizations that are doing just that, and individuals that are doing just that. And for the most part, so far, when we go to court, we win against this administration, because this is so unlawful. Look, there's no question that providers and hospitals and health centers are being placed in impossible situations. But that is exactly why we need to stand up, because the perverse idea that you need to forego the healthcare needs of a small minority, particularly transgender people, in order to preserve your ability to serve the healthcare needs of everybody else, should shock anybody's conscience. And truly, it's, I think, an affront to the oaths that doctors take when they become doctors, that many of us take when we seek to serve our communities. And so I think folks should fight back and stand by those commitments. Stand by those commitments. The answer is that you have folks that will fight for you if push comes to shove. Lambda Legal is one of those organizations. The ACLU is one of those organizations. We partnered together to sue over the denial of care order. We sued with the NAACP Legal Defense Fund over the DEI and gender orders, right? And numerous other organizations are fighting back in these situations. And so I think that folks should, stick to the line, keep moving forward. And if you actually get any attack, then you have folks that will fight on your behalf. But I do think that anticipatory compliance, particularly, which is what we saw, for example, some hospitals do with regards to the denial of care order for people under 19, is incredibly problematic and incredibly dangerous. And in the span of a week and a half, we saw thousands of trans young people lose access to healthcare immediately, not because the administration did anything, but because hospitals overcomplied for fear of what the administration would do. And look, many of them reversed back those actions when we got that injunction. And look, and I know, for example, that Greg, who's speaking to a number of those hospitals, wasn't the one giving that advice. So I just want to make sure that I put that out there. But there were folks that were over complying, and then they reverted back. And I think it's important for folks to actually stick to their values and stick to their commitments to their communities that we serve.
I want to say kudos to Omar and Lambda Legal. They're doing great work. I have a legal background myself. We are not in those lawsuits at NMAC, but I had hoped that we could have with this administration a collaborative conversation. But once the 4 executive orders came out, he got rid of all of the NIH, CDC, SAMHSA. There's about 700 or 800 grants that were helpful to the trans community as well as to the LGBT community. I'm going to have to agree with Omar. I think a collaborative nature is not hopeful for this administration. I don't think he's interested in sitting down and listening to thoughtful conversation, a thoughtful compromise. I'm a compromising person to say, well, how can we work this out? I can't get all I want. You're not going to get all you want. But what can we do? That's not going to happen with this administration. Our only recourse now is legal, which they are holding the line, and we're stopping the military kick out. So I'm going to have to agree with Omar. I would normally say, no, let's work together. Let's not pull out our fighting hands, but we've been left with no choice now but to get a spine, get a backbone, And I would tell these physicians and these healthcare organizations, if this was your child, if this was your family member, if this was your father, if this was your mother, would you want them kicked out? Would you want them denied? I would say probably not. So treat us, the elder Americans, like you would treat your own family. You want your mother to get care. You want your daughter to get care. How about let Tony get care as well? Share the love. So I'm going to agree with Omar pretty much 100% on what he said. Now I'll pass it to Greg for Greg's thoughts.
I personally, Greg agrees. And Omar is one of my legal heroes. So all of that. Some of you on this call may not be in a place to lose your license. Some of you on this call may not be in a place where you can lawfully provide affirming care in the jurisdiction where you're at. So let's reframe the question. What can you do? You can continue to provide gender affirming care through acknowledging patients where they're at, by having conversations with young people of, my hands are tied. I cannot continue to provide you care, but I see you. I acknowledge you. I value you. You are a 10-year-old child who knows your gender, and I believe you. And you can affirm a patient's gender through involving them in their care, treating them like a sentient adult who has bodily autonomy, and also work with your colleagues that gender affirming care, that access to care is more, it's more than just hormones. Again, saying that from the perspective of someone who does not need hormones as part of my care routine, but it's going to be hard. It's going to be ugly, and people may be pooling their meds. People may be doing things that are medically contraindicated, and so for you who are on the care side, predict some of those things. Look around the corner as to what you know what's happening in the trans community. It was happening in the 80s and 90s. So they probably will continue to pool their hormones. How do you counsel people where they're at? How do you affirm people where they're at? And have those conversations with your patients as well.
And one thing I would like to, oh, go ahead, Tony. You're muted.
I see Hope
Don't,
saying, what
there you go.
happens when you lose your federal funding? Listen, I am compassionate. If your job is on the line, I am not advocating for you to lose your home, lose your income. You know, you have to find that median where you feel comfortable doing what Greg and Omar, there's two things going on here. I'm not advocating for anyone to lose their job. I know a nurse practitioner who's told me from Oregon, if I do any more gender affirming care, Tony, I'm going to lose my job. I've got 60,000 of student loans. We're going to lose federal funds. And my boss said, if you care for one more transgender child, we're going to lose funding. Listen, I'm sympathetic. She's still my friend. I still love her. I would never advocate for someone to give up everything for us to lose their job. But I'm just saying there are some things you can do, as Greg has said. You can meet us halfway. I'm not asking you to sell your house, lose your job. Your kids can't go to whatever school they want to go to. I would never, Tony Newman, would never do that. This is an individual choice, but I'm asking if you can't fight like I'm fighting, shouting loud in the face of others, you can do something. And you need to figure out, what can I do to contribute to positivity? Because what Hope put, if we lose federal funds, we have no jobs for doing this work. I get it. And I would never advocate for you to lose your job, but there's something you can do. So find that positiveness in whatever work you're doing and do what you can. I would never advocate, and I want to say very clearly, Hope Dundas, I hear you, I see you. I would never ask you to lose your job. I don't want to lose my job. I wouldn't want anyone coming to me like, come out, Tony, you're going to get fired tomorrow. Who cares? I have a mortgage. I have a life. I don't want to be homeless. So I get it. I just wanted to put that out there. What Omar and I are saying, get a spine, fight back. That's us. I wanted to speak for Tony, but I agree with Greg. You might not be able to stand up loud and shout, I'm going to do it and get fired. So I would never advocate for you to lose your job. I just want to put that out there. That's all.
And the one thing that I know from my personal journey has taken place has really been a self-examination of what I can do. There is a lot that I cannot do, and I have to own that and see it for what it is. But I sat down with my husband, had a really deep conversation. I'm a very public facing person when it comes to the care of LGBTQ adolescents. I'm very out there. I do a lot of public speaking, I do a lot of media work. And we actually had to sit down and talk about this as this energy started changing. And what I said is, I can not do this because this is part of my soul. This is who I am. And at the same time, it is not what my husband's journey is. But he is also very much, who are we going to donate to each month that we can provide people who can do this work, like Lambda Legal? So I encourage all of you who are listening to look inside. What can you do? Because individually, if we all make choices and decisions that are within our wheelhouse, we can be powerful, more powerful than this story of misinformation that's playing out in the world. And one thing you may have noticed today in the conversation, I do not use DEI. I do not use that acronym specifically because it has become a buzzword. It has become a meme and a buzzword and a weapon against our community. Actually saying the words, it's diversity, equity, and inclusion, make a huge difference in the reality and the humanity of this conversation right now. So that's what I encourage, is we need to look inside and all figure out what we can do in this moment. So with that said, let me get off my soapbox for a moment. And we're getting close to time here. And I always like to close with this particular question. And I know right now we are only, 70 some odd days into this maelstrom that we're in the middle of right now. But what do you see? What is your vision of the future? Where do you see yourself wanting to create the future that you want to most come to light? So take a moment, think about that. Tony, I see you're already nodding your head, so I'm going to turn to you. What is your hopeful vision of the future?
Listen, these are hard times. I'm very optimistic. I wrote my book, I Rise, from the poem Dr. Angelou when I met her at Wake Forest during the time I was there as an undergraduate. I Rise to Transformation. It's become more powerful to me now than ever. I don't believe, let me be clear, me and my husband, I don't believe hate and discrimination and transphobia and homophobia. I mean, we're going through a tough time. Absolutely. Look like we're getting bombarded. There are over 50 to 60 cases coming in from all things. I'm still optimistic. I'm a loving, caring person. And I do believe in my heart of hearts. I agree with John. Do what you can. Look in your household and do what you can, but let love be your guide. Let passion be your guide. I work this every day. I'm doing it from love and passion. I'm not angry. Anger doesn't do anything. I'm not busting windows, but I am fighting with love, compassion, and collaboration. So I would leave that with everyone here. Do what you can. John said it so eloquently. You might can't come and march with me on National Trans Visibility March on June 7th in DC. I'll be there fighting and doing policy, marching to the Capitol. You might can't do that, but what can you do? Because when they get me, baby, you better believe they're going to get you. So stand with me in love and passion. Is what I'm asking you to do today. And do what you can. And whatever that is, donate if you can't yell and fight. So I'll pass it to Greg.
My hope for the future is, quite honestly, that a lot of the old white men get out of the way, that stop holding on to a world that is not the same that it was in whatever vision that they have. that there starts to be this recognition that we are a beautiful tapestry of humans with different experiences and different dreams and different goals and different perspectives, and that each one of us on the great bell curve of life is at the top of something. And we are just trying to figure out what is that one thing that we are at the top of that bell curve, and how can we support each other in finding the top of each bell curve? Because once that's there, then hell, we have an amazing just symphony of humans. So I think we're getting towards that. I think we're kind of on the tail end of the revolution that I would or the bleeding edge of the revolution that I hope I get to live to see. And I will continue to write a lot of checks for those who have the vision that I don't have. Um, the intelligence and the bravery that I don't have, that I can continue to just embrace and lean in on the wisdom of Tony, and the bravery of Omar, and the kindness of John, and the vision of Outcare. So those are my hopes and my inspirations and what I see for the future that I would like to live in.
Look, if you had asked me 8 weeks ago, I would have said I was rooting for the asteroid to hit us. But I I like Tony tend to be a very optimistic person, and um seeing us be able to push back in unprecedented ways has been empowering and gives me hope for the future. I think we need to be clear-eyed that we are going to lose people along the way. These are very serious and dangerous times, and we shouldn't ignore that reality. But if anything, I am hopeful based on the conversations that I have with community organizers like Tony, with healthcare providers that care so deeply, deeply about their patients, with parents who so lovingly support their children and their young adolescents and young adults, and with just incredibly resilient people who just know what they're worth and deserve in this life. And I am reminded of the creativity and power of our community, which is that in so many ways, we're able to build parallel structures and institutions to fill the vacuum of what this government is foregoing right now. And that has been a strength of our community from the very start. Nothing has been given to the LGBTQ plus community ever. And we have created our own institutions for a long, long time. And I think this is one of those moments where we need to go back to those roots and show that creativity. And I am seeing people do that again. And that gives me hope.
Thank you. And as we're finishing today, I just want to recognize all the people who joined us for this conversation today as well, both you on the screen and those of you who are joining us in the audience. And also those people out there in this country who are doing this work and are providing the care and providing the love. I want you to know that I see you. We see you. Please continue doing the work. Fear can step in and get into any of our nervous systems and make it hard to wake up every morning. But the work you're doing matters. It matters every single day. And I see you. So with that said, I want to thank you all for joining us today, and thank you so much, panelists, for your amazing wisdom and insight. It was a beautiful conversation. And I invite all of you to join us for our next talk, which is going to be taking on June 12th. We're going to have a little different format. We're actually going to bring out all the people who make Outcare Health happen. And we're going to let you meet them in person and hear a little bit about their journeys, their stories, and the whole mission and creation of Outcare Health as an entity. So it's going to be a really fun conversation celebrating Pride Month and celebrating the pride of Outcare Health. So thank you all so much again for joining us. Be well, be safe, stay strong, and stay well. Take care, everyone.